Hello, and welcome to the MRI brain tumor sequence. I am Yusuf Al-Rajdan. I am a student in Jordan University of the Science and Technology. Today, we will talk about in the brain tumor protocol in MRI modality. Before to start explain the protocol, we are going to talk about the MRI machine in general respect and the most important component in the scanner room. The MRI machine looks like the long narrow tube that has the both ends open. The patient lying down on the movable table that slides into the gantry. Basically, the main component in the scanner room is 1. MRI scanner or the gantry, 2. Patient table, 3. Coil or the different type of the coil, depend on the organ we will be examination. Before MRI examination, ensure the correct preparation by the satisfactory written consent form must be taken from the patient before entering the scanner room. Ask the patient to remove all the metal objects, including the key, coins, wallet, any card with the magnetic strip, jewelry, hearing aid, and the hairpins. Ask the patient to undress and change the hospital gown. Contrast injection risk and the benefits must be explained to the patient before the scan. Gadolinium should only be given the patient if the GFR is the greater than 13. If the possible, provide the relative or the stop for the claustrophobic patient. After carrying out your safety check, bring the patient into the scanner room and help them to lie supine in the table with their head in the head coil. Provide the patient with emergency buzzer and the headphone to protect the patient ear. After then, put the head coil in the place and the center to the glabella. After then, move the patient to the scanner. Make ensure they comfortable before they leave the room. Once back your room, select the correct patient detail in the system, including the name and the breath and the patient weighted and other information. Select the lying patient on the head first and the supine. After them, select the correct protocol according to the hospital. Start with the localizer. The sequence in the 3 plane, axial, sagittal, and coronal. From the sagittal localizer, obtain the axial slice. Should the center parallel to the line anterior and posterior commissure. The slice should cover the brain from the vertex to the below foramen magnum. From coronal localizer, the central slice passes the long line from the superior-sagittal sinuses through the third ventricle and the center of the brain system. Axial localizer, center of the field of the view. Now we select the sequence by Suhaib Abu Adas.
We thank our colleague Yusuf for what he has provided, and now I am the student Suhaib Al-Gawagze to continue. First of all, at the beginning we will explain the sequence. For brain MRI tumor, we have 3 protocols. First of all is axial T1, and the second is axial T2, and the third is sagittal T2. In case we want to use the gadolinium, we will administration of 10 milli of gadolinium. The rate will be 0.2 milli per kilogram. The protocol will be axial T1, coronal T1, sagittal T1. And now we will explain about the type of image and what are the plane and the purpose of the image. About T1 weighting image, the plane will be axial and sagittal. The sequence will be fast spin echo or gradient. The purpose of this image, anatomical overview, which include the soft tissue below the base of the skull. T2 weighting image. The plane will be axial and the sequence will be T2 fast spin echo. The purpose of this image will be elevation of the basal cistern and ventricular system and subdural space. Flare image. The plane will be axial and the sequence will be flare. The purpose of this image, assessment of the white matter tumor involvement and related vasogenic edema. Post-contrast sequence. The plane will be axial and coronal, at least two different planes. The sequence will be post-contrast fast spin echo or gradient. A fat saturation sequence is considered in at least one plane, especially when a tumor involves the skull base. And now, my colleague Usaid Jadat will complete with you to explain the differentiation between the image sequence. Thank you.
Hello, I am Usaid Jadat. I talk about differentiation between sequence image. The first sequence is T1 weighted image. طبعا زي ما بنعرف انه بالتي 1 الفلويد ببين دارك ان lateral ventricle. السيكونس الثاني هو عبارة عن axial T2 weighted image. طبعا الفلويد باللاترال ventricle راح يكون برايت لأنها صورة T2. السيكونس الثالث هو sagittal T2 weighted image. زي ما هو مبين بالصورة السيبروسباينال فلويد باللاترال ventricle برايت لأنها صورة T2. بعد ما أعطي البيشنت 10 مليلتر من الجادولينيوم راح تطلع عنده صورة أكزيال T1 posterior contrast. وزي ما احنا ملاحظين بالصورة التيومر برايت كثير. برضو بعد ما أعطي البيشنت 10 مليلتر من الجادولينيوم راح تطلع عندي صورة sagittal T1 posterior contrast. برضو هون التيومر برايت كثير مبين. وآخر سيكونس معنا هو الكورونال T1 posterior contrast. وهسه راح يحكي لكم زميل حسين عن الأناتومي.
Hello, my name is Hussein Abidat. I will talk today about the anatomy of the brain. In the first picture, we can see it is a sagittal view, and in the top side, we can see the body of the corpus callosum, and in the posterior side, we can see the splenium of corpus callosum, and in the anterior side, we can see the genio of corpus callosum, and in the middle side, we can see the thalamus and the pons and the pituitary gland. So here in the second picture, we can see it's a coronal view, and this is the posterior side of the head. In the first, we can see the splenium of corpus callosum, and the thalamus, and the pineal gland, and the cerebral aqueduct. If we go more inferior, we can see the fourth ventricle, and the right side, and the left side of the fourth ventricle, we can see the cerebellum. So this is the axial view, and in the superior side of the picture we can see the genio of corpus callosum and the frontal horn of lateral ventricle, and in the middle we can see the septum pellucidum and the thalamus and the choroid plexus. In the inferior side we can see the occipital horn of lateral ventricle and the splenium of corpus callosum and the falx cerebri. وهسه راح أتكمل معكم زميلتي بيان.
I am Bayan Abu Hussein, and I am going to talk about some types of brain tumors and how they appear on MRI images. First of all, brain tumor is a collection or mass of abnormal cells in the brain. They might be benign or malignant. First, we will talk about primary brain tumors. It means that the tumors begins in the brain. In adults, most common types are glioma and meningioma. Glioma is a brain tumor that can develop from different types of glial cells. This MRI scan shows one type of glioma, which is low-grade oligodendroglioma. Image A is a T1 sequence demonstrating T1 shortening in the right frontal lobe. B is a T2 sequence demonstrating T2 prolonging or hyperintensity at the site of glioma. C is a contrast-enhanced image of glioma showing no marked contrast enhancement. The second type of primary brain tumor is meningioma. Meningiomas are extraaxial tumors. This means that the lesions are external to the brain parenchyma. They originate from meningiocytes or arachnoid capsules of the meninges. These MRI images shows atypical or grade 2 meningioma with skull invasion. Atypical meningiomas are neither malignant nor benign, but may become malignant at some point. They tend to recur and grow faster. Now we will talk about brain metastasis, which is a secondary brain tumor that originates from primary tumors, such as lung cancer, renal cell carcinoma, breast cancer, melanoma, and gastrointestinal tract adenocarcinoma. The first image is a brain metastasis originating from a breast cancer, and the second image is a brain metastasis from colorectal cancer.